Thank you, Dr. Saurabh. A very good afternoon to all of you. Let me begin with a question. What was that one thing that immensely transformed healthcare back in the late 90s or early 2000s? Anyone? Sorry? Okay. Media, okay. Okay. And so we've got Google, media, privatization, social media. A lot of people are talking about social media because that's the topic. But it was the advent of technology, the digitization of records, the hospital systems, the connects that we could form, and it fundamentally changed the way that we provide care. Today, we are standing at a similar inflection point, and the difference is that the catalyst is social media. So, it is redefining how we seek information, how we form trust, and how we experience healthcare even before stepping into the hospitals. Just like during COVID, when people could not come to the hospitals and there was a lot of misinformation, social media helped dispel that misinformation, provide the facts, and enable patients in their home. So we are moving on to a topic that sits right at the intersection of patient experience, trust, and modern communication. Harnessing the power of social media for healthcare transformation is no more optional, it's a strategic necessity. To take us through this, we have Mr. Harbinder Narula, a prominent figure in India's business and media landscape. He is the CEO of BW Business World Healthcare and Wellbeing. With over 26 years of experience, he has shaped business journalism and healthcare communication through impactful stories, large format interviews, and strategic partnerships that have strengthened BW Business World's voice in the sector. We welcome Mr. Narula.
I am somebody who is very fidgety, so I'd like to move around. And the handheld mic. It's very interesting because usually people move from journalism to digital media. For me, the journey has been the other way around. I was into digital media, I was into social media, and then got into journalism just a few years ago. And I used to be at Google looking at content across all the things, all the applications, products that many of you may be using, whether it was YouTube, Google Maps that we're looking at. And suddenly, I started wondering that there is a company in the US called WebMD. And I used to wonder, how do they make money? And that curiosity led me to understand the power of digital media, and I got so interested that I made that my career. I got into healthcare. But let me begin by telling you a little story of a very recent conference. I attend a lot of conferences. In fact, Dr. Gyani and Dr. Sanjeev Singh were saying कि ये तो इंडस्ट्री का डॉन है. मैंने कहा कि मतलब पॉजिटिव सेंस में है, नेगेटिव सेंस में है. But in that conference, I was talking to a CEO of a very large hospital, and he said that, Harbinder, today my competition is not another hospital in the city. It is that 23-year-old creator on Instagram who is able to explain a particular condition, a health condition, and the treatment protocols better than my whole marketing team. That was a very powerful statement. Next thing, in that same conference, there was a surgeon who is a well-known robotic, he does a lot of robotic surgeries, and he tells me that Harbinder, मेरे पास ना एक पेशेंट आया और वो जब मेरे से बात कर रहा था उसने बोला कि सर मेरे को नहीं सर्जरी के बाद सारा मालूम मैंने यूट्यूब पे देखा था, एंड ही सेड आई फेल्ट लाइक टेलिंग हिम आज स्क्रब पहनते हैं इकट्ठे करते हैं सर्जरी, ठीक है ना. सो दैट इज व्हाट इज हैपनिंग इन द स्पेस ऑफ डिजिटल मीडिया. आई हैव आल्सो had or heard conversations of nurses who have lot of experience, who are struggling hard to explain to the patient on the bed कि आपका बीपी ठीक है, ये मॉनिटर पे दिख रहा है. वो कहता है कि वो ठीक है, लेकिन मैंने कहीं पढ़ा था कि ऐसा होता है, इतना बीपी हो तो ये प्रॉब्लम हो जाती है, वो प्रॉब्लम हो जाती है. Is that a reality any of you are facing today? Yes. So that's something that led me to start wondering that social media हमारे हेल्थ केयर में क्या रोल प्ले करता है. Got these notes because मेरे को बड़ा स्ट्रिक्टली बोला गया था टाइम मेंटेन करना, और आई कैन स्पीक फॉर आवर्स ऑन दिस पर्टिकुलर टॉपिक. टुडे आई एम श्योर यू वुड एग्री दैट हेल्थ केयर begins everywhere, on Instagram, on YouTube, on Facebook, before it actually begins in the hospital, in the OPD. Patients are forming impressions, perceptions, they are making choices based on the information that they are consuming, they are building trust. In fact, just yesterday I uploaded a video because somebody asked me, I am an evangelist for personal branding. And I keep telling every doctor that you need to go out and build your brand. And I am always getting a pushback saying that यार हम marketing नहीं कर सकते हैं, हम अपने आप को promote नहीं कर सकते हैं. But किसी ने उनको ये नहीं बताया कि जब patient आता है आपके पास, the first thing that you should feel is कि I am under the right care, I am under the right care of the right person. That is the brand, and that is the commitment towards branding that every doctor, every hospital owner needs to start building. Sadly so, a lot of patients also try and diagnose themselves. Now this is an area of concern, but this is also an area which is an opportunity for trying to help people understand कि मेरे को कुछ प्रॉब्लम है तो मुझे एक हेल्प की ज़रूरत है. आई शुड बी गोइंग टू अ हॉस्पिटल, आई शुड बी सीकिंग हेल्प ऑफ अ डॉक्टर. मोस्ट ऑफ द पीपल इन द अर्लियर डेज वुड हैव हैड अ प्रॉब्लम एंड वो सोचते थे कि ये ना एसिडिटी है, ये प्रॉब्लम है, ये वो प्रॉब्लम है, इट्स नथिंग मेजर until it becomes an emergency. So I think social media in that aspect is actually doing some good. In that chaos of reels, relatives, कितने लोगों ने देखा है कि पेशेंट होता है उसको बताने वाले डॉक्टर से ज़्यादा रिलेटिव्स होते हैं जो अपना एक्सपीरियंस बता रहे होते हैं. क्रिएटर्स एंड इन टुडेज डे एंड एज द सेल्फ प्रोक्लेम्ड एक्सपर्ट्स who are not qualified but they feel that they are entitled to go share information online. That's a very, very big challenge. What is really missing is the voice of the person who matters most. Somebody who's qualified not only by academics but also with experience to go out and share the information which is otherwise being put in by those who are not qualified to share that information. That's the responsibility that the healthcare system needs to look at. और ये लोग कौन हैं? ये हॉस्पिटल लीडर्स हैं, ये लोग डॉक्टर्स हैं, क्लिनिशियंस हैं, डायग्नोस्टिक्स एक्सपर्ट्स हैं एंड नर्सेस हैं. You know what you will find, अगर आप ऑनलाइन जाएंगे इंस्टाग्राम पे बहुत सारे डॉक्टर्स हैं, but the major difference that you would find between the doctors and the healthcare system that is there on online in India versus what you would find in the US is that they have given importance to nurses who have gone online and have started creating content. You know, यहाँ पे कहीं ना कहीं वो एक चीज़ मिसिंग है, पता नहीं क्यों है, but I think and I'm hoping that things are changing. That is why I feel that social media is no more a promotional tool. It is more about a trust tool. वहाँ पे जाके जब हमने, जैसे आपने बोला कि जो दिखता है वो बिकता है, it is so important that, we must understand that people are creating a perception about how good a doctor or how good the facility is when they are watching this content online. The transparency tool, हम सब हॉस्पिटल तब जाते हैं जब हमें ज़रूरत पड़ती है. We have never been to a hospital otherwise. But what to expect is something which needs to be told to the world that, what is it that you could expect when you go to AIMS? What is it that you could expect when you go to Sarvodaya hospital? What is it that you could expect when you go to Max? Public health tool. And last is the bridge between the healthcare system and the people it serves. Now, if we don't show up with clarity, empathy हम बहुत commonly use करते हैं, patient centricity, etc., and authenticity, then someone else will come in and talk with confidence, with creativity, with absolutely no qualifications. Now, this is really why this conversation needs to happen. I mean, what we're talking. I'm coming to the topic that I'm supposed to speak on. Is the slide show again? That's all. So healthcare is basically undergoing a silent transformation, and the shift is not happening in the hospital, it's actually happening online. How many of you believe what I just said? That the shift or the transformation that is happening in the healthcare system is slowly happening in the hospital, but is more aggressively happening in the digital space. Patients' first point of contact with healthcare is what? Any idea? First point of contact with the healthcare system कहाँ होता है? Sorry? Call center. Anyone else? Front desk. Sorry? It's on the digital front. The first thing that people do is to go online to Google their symptoms. The first thing that they do is to go online to find out where can they get help. हमें से सबने बचपन से सुना है कि important numbers अपने सामने रखो, लिख के रखो. हम लोग पहले डायरेक्टरी में लिख के रखते थे, फोन में लिख के रखते थे. How many of us have the numbers? I mean, look at it. जब emergency पड़ती है, हमारे पास कुछ भी available नहीं होता. First thing we do is to go online and find out where is it that I can get help. Second is, when you look at the digital patient journey, patients are searching online. Patients are not just searching, people are comparing healthcare facilities online. People are comparing doctors online. People are comparing hospitals online, and based on that comparison, they make their choices. So are we actually doing service to our own institution, to our own teams by being present in the online space? Now imagine if your patients are online and you are not, what is missing? Second is transparency. Now transparency, I believe, is a great trust multiplier. When you look at trying to figure out, हम जब ढूंढते हैं डॉक्टर, किसी से पूछते हैं कि कोई सजेस्ट करो डॉक्टर, तो हम ये नहीं बोलते कि कोई किसी डॉक्टर को जानते हो. We go and ask a question that, can you tell me a good doctor? Hoping that they will tell us a doctor that we can trust, especially in today's day and age. Now, isn't social media an opportunity for us to simplify this complexity of finding your doctor, understanding how good or bad the doctor is, what the world is talking about them, and let people make intelligent choices? Now, when doctors share insights, especially on video, I do a lot of videos, and the reason is because, video offers you an opportunity to be the closest to actually meeting them face to face. When you watch a video, you are able to create a perception about क्या ये डॉक्टर सयाना है,
Is he a good doctor? Does he know? Is he knowledgeable? Does he seem like somebody who is receptive? Is he approachable? And then, based on the perception that we have created in the minds, we start looking at approaching that particular institution where the doctor is. Now the second thing is the diagnostics and early detection. Today digital and social media has enough and much content that is reshaping the way the screenings are being explained to people. People understand the protocol. There is that fear of unknown which is being addressed by social media. पहले डर लगता था, एक fear होता था hospital जाते हुए, diagnostic center जाते हुए. I think the social media has the opportunity to address this particular thing. The next thing that is very, very critical is, and I am very, very vocal about it, is that the nursing needs a voice. Do you agree with me? Right? Nurses are an emotional backbone of the healthcare system. डॉक्टर थोड़ी देर के लिए जाता है, डॉक्टर एक सर्विस प्रोवाइड करता है, बट एम्पैथी जिस वर्ड को हम इतना ज़्यादा यूज़ करते हैं in day-to-day life, in healthcare, that is actually being demonstrated by other than the doctor, which is the nurses, the paramedical staff, etc. People who are engaging with the patient and the patient's family more than the doctor while the person is in the hospital. Today, hospitals, I believe, are the community builders, and there's a reason I say that. If you look at how hospitals operate, I've had the opportunity to come and visit Sarvodaya hospital earlier with Ansuji, and she took me around the activities that they do outside of Sarvodaya. Now what is it doing is actually building a community outside in the periphery of the area that you serve. You are able to contribute to the community so that they start trusting you. Second is, have you heard of survival circles around the oncology space? That is such a powerful thing, because the first thing that people are dabbling with when they are dealing with cancer is the mental health, because they are taken by surprise. The family has never been prepared for either the financial stuff or the emotional stuff. They don't know how to deal with the disease. They don't know how to deal with the challenges that come with the disease. And last but not the least, the amount of engagement that is being offered is commendable. I mean, how else would you engage with not just the medical fraternity, but with the patients or the possible patients who would come to you. Now when we look at India, we have a very distinct advantage. One, we are a younger demographic compared to the world, right? But we also are facing a challenge of the gap between the access of healthcare versus the number of doctors that are available. Somebody else also spoke about this. Third is, we have seen a rapid adoption of this piece of technology that we have everywhere. In fact, some of us have 2 or 3 phones. So we have technology and content available to us at every point in time. And the last thing that is there in this area is that we are dealing with lack of trust in the healthcare system, right? Now, keeping in mind we have a younger generation, they are using technology which is available to them, they are accessing content. Don't we see the opportunity of how we can start building trust in our healthcare system, not just our hospital, but the system in itself. Real-time feedback. I mean, we are seeing technology coming in. हम सब बात करते हैं feedback की in terms of the equipment that we are using in the hospital, in the ICUs. But what about somebody who's putting a comment on your website, on your social media pages? Do we go back and listen to them? Right? We probably don't. Social media, I believe, kind of reveals the expectations that the community has from you as a healthcare provider. उसको सुनेंगे, उसको हम address करेंगे, तो we'll be able to serve the people much better. So I think the comments and the messages that keep coming could be talking about the service gap that needs to be bridged. They could be talking about the communications gap. मेरे हॉस्पिटल ने मेरे को पता ही नहीं, मेरे को याद ही नहीं आया कि मेरी अपॉइंटमेंट थी, मैंने मिस कर गया, सॉरी. Or the opportunity for improvement. Then is the crisis management. In healthcare, information spreads, but misinformation spreads very very fast. कुछ गलत होता है तो पूरा इंटरनेट लोग भर देते हैं. In fact, I'll tell you what, in 2010, I started working on something that I saw in the US, which was Radio Doctor. हमने सॉफ्टवेयर वगैरह डेवलप किया, हमने एप्लीकेशन डेवलप करी, and ultimately after 1 year of work, we chose not to launch it. And the reason was that we realized that we are operating in a country which has a population which is very emotionally driven. जो जिसका पेशेंट जहाँ ठीक हो गया उसके लिए वो डॉक्टर भगवान है, लेकिन अच्छे से अच्छा डॉक्टर है, लेकिन अगर पेशेंट ठीक नहीं हुआ, चाहे पावर इन एवरीबडीज हैंड दैट एनीबडी कैन गो एंड राइट एनीथिंग अबाउट यू. सो सोशल मीडिया को आप इग्नोर नहीं कर सकते. दिस हैज टू बी अ प्राइमरी टूल टू गो मैनेज द क्राइसिस और द रेपुटेशन ऑफ द इंस्टीट्यूशन एंड द डॉक्टर. Then is leadership communication. How many of us actually go out and position ourselves as thought leaders and share the information? Today, every doctor who's not just qualified because of academics, but those who have spent 20, 30, 40 years in the industry, they have wealth of experience and knowledge of having observed cases which are not the common cases. So do we go out and speak about it? Do we go out and mentor the others? I think social media offers us this opportunity to do this good for the benefit and the growth of the healthcare ecosystem. We are talking about ethics, we can talk about patient safety, digital health, and innovation. Because there are two things that leaders do when they are actually going and speaking in the social media. One is creating a public confidence, and second is to create industry transformation. Thank you, because this is my last slide. What happens is, if you look at social media, it is all about intention and authenticity. These are very very simple terms, but very very difficult to go and demonstrate your intention in the industry and to speak with authenticity. And I truly believe, like what I've written here, that future of healthcare communication is the future of healthcare itself. With that, I'd like to conclude. This is me. We can connect online anywhere. Since we are talking of social media, I'd like to promote my social media handles. Thank you so much.
Thank you so much, Mr. Harbinder. Thank you for the insightful session and very realistic. This is something that, since everyone has a phone in their hands and everyone is online most of the time, they really relate with it. You covered topics like how social media can be used for patient education, trust creation, even before they visit the place. People these days see the doctors. If I have to go for a certain ailment to the hospital, they will compare. Experience. So who do I relate to? So, and creating communities is very important. Like in the case of cancer and other places where people are going through similar things, they share experiences. And it really, really helps them, largely in the mental space as well. And feedback creation. We have seen things change immensely, and it creates transparency, enables the patient to get the right kind of health care. Thank you so much.
Thank you so much, Ms. Sampradha and Mr. Harbinder. May I request Githal General Secretary please come on stage and felicitate the young talent. So we find you most young to be called on the stage. आपको परेशान कर सकते हैं.